Okay, there you go. Good afternoon, everyone. Thank you so much for being here. Before we get started, sorry, phones, that didn't work out for me. Before we get started, I ask that you double check that your video and microphone are off, like I'm going to. And please note that we will try to live stream this event on YouTube. But full disclosure, we've never done anything like this before, and therefore we cannot guarantee that we will be successful. So please bear with us. But with that said, we will be recording today's discussion and plan to post it to our website and Facebook page, hopefully sometime in the near future. So let me start by saying that as a Jersey girl, born and bred, I could not be prouder of our great state. We are fortunate to have so many different maternal health organizations that continue to positively impact mothers across our diverse communities. And while our focuses may vary, the one common theme we share is maternal empowerment. Our hope is that by sharing our experiences, knowledge, and advocacy efforts here today, together we can begin to work towards the common goal collectively. Personally speaking, never in my wildest dreams did I ever expect to be where I am today as an advocate. But from the moment that I brought my daughter Autumn into this world, still almost 10 years ago, my life has never been the same. The bright path that I was on once, so full of possibilities, hardly veered off course. I found myself suddenly thrust into any expectant mother's worst nightmare. In the months following Autumn's death, I could barely keep my head above water. I was drowning. Something had to give. It soon became apparent to me that the only way that I can maintain any level of sanity and move forward in my life was to act. And while Autumn's death served as the catalyst that drove me to this place, traumatizing maternal health events leading up to that point are what solidified my current position. I've suffered horribly over the years from various experiences with doctors and hospitals. I have been ignored, humiliated, and manipulated multiple times into thinking that my very real symptoms were just in my head. At one point, things were so bad that I almost lost my life shortly after the birth of my first child because I didn't have the confidence to advocate for myself when my concerns were being brushed off and minimized. Regardless of always considering myself outspoken and vocal, I learned the hard way that it did not necessarily translate into me being an empowered communicator. Losing Autumn was simply the final straw for me, and I could no longer remain silent. My doctors led me to believe that my losing Autumn was as rare as being struck by lightning, but I soon came to the realization that this wasn't the case. Approximately 700 stillbirths occur every year here in New Jersey, leaving no pregnancy immune. Even then, there are significant racial disparities for stillbirth, with Black women 3 times more likely to suffer one when compared to a white woman. Even with numbers like these, stillbirth remains one of the most misunderstood, understudied, and underfunded public health issues today. But for the first time in 10 years, I can honestly say that I see a light at the end of the tunnel. Seeing maternal health finally get a seat at the table at both the state and federal level fills me with immense optimism. And it is at that same table that we sit today, where I hope we can begin to work together to weave empowerment into an all-inclusive maternal health conversation. We are at a crucial crossroads where we can make meaningful changes by working together that will positively impact the future of all mothers, babies, and families here in New Jersey. And I'm ready to get to work. So without further ado, I am honored to have the privilege to introduce our First Lady of New Jersey, Tammy Murphy.
Good afternoon, everyone. Debbie, thank you so much for that introduction, for your work with 2 Degrees, and for sharing your story, indeed your Autumn, with us. From the very beginning, mothers have been the most powerful and moving voices behind this movement, and I am so grateful to every mom who has shared her story personally or privately. You all continue to be powerful advocates and inspirations. And I am so proud to count you, Debbie, and all of the speakers on this panel as our partners to Nurture NJ. Our missions all overlap, and raising awareness about New Jersey's maternal and infant health crisis has been one of the most important parts of our initiative. Once aware of this issue, people are immediately motivated to work together with us. So here again are the haunting statistics. The United States is ranked 55th in the world for maternal deaths, and New Jersey is ranked 47th in the nation. And our racial disparities are even worse. In New Jersey, a Black mother is 7 times more likely than a white mother to die from maternity-related complications, and a Black baby is 3 times more likely than a white baby to die before his or her first birthday. These disparities are also seen in our fetal mortality rates, as Black women in New Jersey are at the highest risk for fetal deaths, more than 2 times the rate of Hispanic mothers and almost 3 times the rate of white mothers. This unacceptable reality has been the impetus behind all of Nurture NJ's work. Our family festivals, our Black maternal health summits, our partnerships with legislators, and our maternal and infant health strategic plan, which we released just 2 weeks ago. The Nurture NJ strategic plan is the culmination of over a year of in-person and virtual meetings with our stakeholders, including departments and agencies, health systems, physicians, doulas, community organizations, and most importantly, mothers and their families. It is designed to make transformational change in a system that has historically failed our mothers and babies of color. Its goal is to reduce our maternal mortality rate by 50% over 5 years and eliminate the racial disparities in health outcomes. And it's part of our New Jersey response to the cry for racial justice that we have all heard across our nation. The plan requires all sectors, health, education, housing, business, academia, government, and more, to play an integral role in its realization. And ultimately, the success of this plan relies on our active partnership and collaboration. At its most fundamental level, the plan meets the specific needs of women in their local communities, where they live, work, worship, play, and love. The recommendations range from increasing prenatal care and support for women of color, which are incredibly important to monitoring fetal health and can reduce the risk of stillbirth, to creating a groundbreaking maternal health research and innovation center. And it makes broad reforms aimed at dismantling the structures that for generations have prevented women of color from living in environments that provide the resources needed to simply be healthy. These are important factors for us to consider when we discuss self-advocacy and empowerment. Finding ways to help mothers speak up, ask questions, and advocate for themselves is incredibly important, but we must also do the work necessary to ensure that when they do speak up, someone's listening. And I know that together, only together, with all of us working on every aspect of maternal and infant health, we will both combat our maternal and infant health crisis while also making New Jersey the safest and most equitable place in the nation to deliver and raise a baby. And with that, I want to thank all of you for your participation today, your commitment to the women and babies of New Jersey, and your partnership on this challenging, meaningful, and urgent mission. Thank you so much for having me, Debbie.
And thank you, First Lady. It means a great deal to have you here today providing opening remarks. We are so inspired by your incredible work. The outreach and advocacy that you've been able to accomplish through Nurture New Jersey is nothing short of extraordinary. We're taking notes. Next, I would like to introduce Rosie Driscoll on behalf of Senator Bob Menendez, reading a letter of greeting.
Good afternoon, everybody. It's wonderful to be here with you today. Thank you to Debbie and Stacy and the whole team at 2 Degrees. So my name is Rosie Driscoll. I handle health and women's rights issues for Senator Menendez in state, and I have a letter from him that I'd like to read to you all today. Dear friends, please accept my warmest greetings as you gather virtually with the 2 Degrees Foundation for today's Maternal Empowerment Roundtable. Founded upon a mission to provide every family in New Jersey a fighting chance against stillbirth, the mission of the 2 Degrees Foundation is a laudable one. I applaud all those taking part in today's roundtable for their commitment to maternal and infant health here in the Garden State. As your senior United States Senator, I'm honored to stand with advocates like all of you and to fight for high quality, affordable health care in Washington. My best wishes for today's event and my hope that you stay safe during this time, Senator Bob Menendez. And I also just want to add on a development that's come through in the last few days. Senator Menendez is a proud original co-sponsor of Senator Booker's Black Maternal Health Momnibus Act, which is a series of 12 bills designed to save mothers' lives and to end racial and ethnic disparities in maternal health outcomes. And that was first introduced in the last Congress, but just a few days ago, it was reintroduced. So that's something that I know is near and dear to the Senator's heart, and I wanted to share with you all today. Thanks so much, Debbie.
Thank you so much, Rosie. And please let Senator Menendez know how much we appreciate him wanting to be a part of today. And thank you for being here on his behalf and for sharing that news. It's very, very exciting. So next up, I would like to introduce Stacy Denberg. Stacy is my grieving mama confidant, my partner in 2 Degrees, and most importantly, one of my dearest friends. While the loss of our girls and our intense grief is what originally bonded us, I couldn't imagine my life without her. Stacy's one of the few people that truly gets me and someone that I can always count on for a good laugh or a good cry. On a daily basis, I am encouraged by Stacy's immense strength, great courage, and unwavering commitment to 2 Degrees. I feel extremely lucky and privileged to be on this journey together with her. And without further ado, it is my great pleasure to introduce to all of you, Stacy Denberg. You have to unmute. You're muted.
Sorry, you got me all verklempt. Thank you, Debbie. I really appreciate that beautiful introduction. Thank you. I feel extremely honored to be here today. Sorry. I apologize. Sorry about that. I'm honored to be here with all of you today and share my personal story in regards to maternal empowerment. It wasn't an easy journey for me. I'm sorry, I'm having some technical difficulties. Okay, I apologize. Many of us here today, myself included, has endured stigma, setbacks, and even the painful tragedy of loss. And yet, we continue advocating for, I like to consider myself a survivor, but it took a very long time and a lot of personal growth for me to come to this determination. 7 years ago, after a challenging 3-year battle with infertility, my first child, Ryaneva, was stillborn at almost 37 weeks. I was completely devastated. I felt inadequate and alone. Not only did I lose my daughter, but I lost my dreams and my future. I lost all hope in myself, the medical community, and in my faith. I was left traumatized, knowing that my best efforts to advocate for myself and for my daughter were just not enough. If I only knew then what I know now, I can't help but to think that the outcome would have been a bit different. And that is the guilt that is with me for the rest of my life. But as with every loss, there are awfully deeply hidden gains. I researched and I read. My family and friends helped me up when I could barely stand, by their love and support. I sought out special mental health care from two amazing providers who helped me grieve in a healthy way. I found an MFM, maternal fetal medicine doctor, and a team of caring nurses who showed me that it was, individual care, healthcare does in fact exist. They taught me it was okay to ask questions and that it was best to trust my intuitions. But the honest truth is that hope didn't re-enter my life until I found my foundation partner, Debbie. Her inner strength and will to fight for autumn truly inspired me. She motivated me to use my voice to create awareness, in return, gave my daughter's short life meaning and purpose. Her friendship and support helped me allow myself to begin to heal. And well, the rest is history. Shortly after losing my daughter, Ryan, I had heard about a news anchor from New Jersey who had lost her daughter shortly after birth. I was compelled to reach out to her and provide her with the same comfort that Debbie had provided me with. We shared experiences with one another and quickly became friends. We leaned on each other during difficult times and celebrated joyous times, including the birth of our rainbow babies who were born only 2 weeks apart. Still to this day, we call each other to chat about our post-trauma obstacles, including the trials and tribulations of parenting after loss. The special bond that is created among lost mothers is truly, truly invaluable. It gave me a sense of belonging, knowing that I was not alone. Pregnancy and infant loss is truly a lifelong struggle. Marriages fail, friendships dissolve, jobs are lost, and families can fall apart. Far too many women suffer alone in silence. I am one of the lucky ones who have found the confidence to speak out and provide hope to others. It is my job now to lift mothers up and support the importance of empowerment. I would now like to take this time to introduce my good friend, fellow survivor, and event moderator, Marissa Brainy.
Thank you so much, Stacy. I am also verklempt because thinking back to when we first connected and when you first sent me that very first message, really within weeks of losing my daughter, it was a lifeline for me, just as Deb was for you. And so the chain goes on. And what the three of us have done since then is really continued that on. And that's really why we're all here today. I think we've all realized since losing our daughters that pregnancy and infant loss is also a mother issue. It's a baby issue, but it's a mother issue. And as mothers to our other children, we see the impact that this has had on our lives, will have on their lives, and how crucial it is for that support to be there. So I really appreciate you and Debbie asking me to moderate this today. A little bit of background on me for those watching who don't know me. I am a former news anchor. You may have seen me on News 12 New Jersey if you're a watcher and a Jersey girl or guy. I was an anchor there for 6 years and reported in various places before that for 15 years over the course of my career. I left a couple of years ago to do some other TV hosting. And but my loss happened when I was an anchor on News 12. So it was my first pregnancy, my first baby, very naive to any sort of complications that could arise, certainly post-delivery. In my mind, that was something that happened decades ago. I had been familiar with miscarriages and kind of had this false assumption, as many people unfortunately still do, that once you get past that 12-week mark, you know, it's very, very rare for something to happen that would affect mother or baby. And, you know, if I only knew then what I knew now, I'll say the same thing Stacy did. I know now how wrong that assumption is. And yet it still persists. And so I think that that is one of the reasons we're all here today in various forums and with our various organizations and our various causes. For me, I had a full-term, totally normal pregnancy, nothing out of the ordinary, no cause for concern. I was relatively young. I was under 35, which, you know, that is considered the marker for when more complications could arise. So there was nothing in my history that was indicative of any pre-existing condition or any reason to be worried. I was about a week late when I went into labor. And, you know, as Stacy said, people who watched the news, you know, everyone knew I was pregnant. There was no hiding. I worked up until my due date. I went off the air, went to go have my baby. I went into labor about a week after my due date, went into the hospital thinking we were going to bring our first baby home. And when my daughter Charlotte was born, she wasn't breathing. And it was immediate trauma and panic in the delivery room. It was a vaginal birth. Again, no signs of any distress during the labor. And so it was an extremely traumatic experience as doctors whisked her away, realizing she hadn't taken a breath, and, you know, worked on her for about an hour and a half in the NICU with my husband and I sort of trying to figure out what was happening. No one really telling us anything. And unfortunately, they couldn't get her to breathe. She had aspirated meconium in the womb. And it was just too far deep into her lungs for doctors to be able to intubate her and get her to breathe on her own. What followed was such shock and devastation, and really an undoing of, you know, all of the things along the way, all these things that, well, if I did this could have been different, or should I have asked this, or, you know, all of these things that I really realized after the fact, I wasn't all that empowered on. I thought I had done my research. I had read everything. I had been in mom blogs, you know, but I realized afterward that there were so many things I didn't know and so many questions that I didn't ask. And really, that was the case even up until my second child was born. I had a complicated miscarriage a few months after losing Charlotte. And so it was a long, hard road to get to our rainbow baby, our son Kennedy, who is turning 5 on Friday. And I'm blessed and so thankful that I have gone on to have 3 children since Charlotte, all under 5. So my house is crazy, but I welcome it. It's wonderful. And so I have, like Stacy and Deb, really found comfort and solace and meaning in carrying on my daughter's legacy through helping. Hard to not get emotional about it. But that is what my experience has called me to do. So I'm so thankful to be here today. I'm thankful to all of you and your incredible organizations for the work that you do for mothers and for families in our state. So without further ado, I do want to enter into the roundtable and bring in our first guest. And Ryan and I have kind of shared a couple circles over the years. I realized as I was preparing for this, Ryan, we have some mutual friends, and I've read about the incredible work that Ryan does through his organization. So for those who aren't familiar with Ryan, he is the founder and president of the Tara Hansen Foundation. He founded the foundation in the spring of 2012, just 1 year after he lost his wife, 6 days after giving birth to their first child. He has been speaking and fundraising as an advocate for maternal health in the United States since then. And this number stopped me in my tracks. The foundation has raised more than $200,000 in the name of patient safety for women and their families. So just an incredible amount of work that Brian has done. Not to mention, as a co-creator for the first Maternal Health Awareness Day, the Stop, Look, and Listen Safety Campaign, and so much more. So I want to bring Ryan in now. And Ryan, I have just an intro question for you. Tell us why maternal empowerment is so important to you and how it has played such a significant role in your life.
Yeah, so real quick, just a thank you to everyone here on the panel today speaking. Everyone's story is just incredible. And just, I appreciate everyone, welcoming me today and to be a part of this. So thank you very much. So for me, I think my journey to have this, as I was going through my notes and putting things together, to have this maternal empowerment moment, and echoing kind of what everyone's saying here is, I didn't realize that this was an issue, that maternal mortality was an issue, that something could happen to my wife during pregnancy and childbirth, until it did. It was really, I tell people, I didn't know about any of this until we suffered our loss. And that's really been kind of the focus of what we've tried to do from there, is that everyone should know what's happening, how they can protect themselves best. I always say, Tara had a wonderful pregnancy. I'm so thankful for that. All the classes that she did, all the appointments, all the books, she was so, just so dedicated to it. But we never had, a plan for her following delivery, right? So we're so ready to bring our son home, to meet him, to greet him, to do all the things and be in that moment. But there was really no plan for her care. And it's something that we sort of realized along the way, that as she talked about how she was feeling and what she felt, we looked at each other and we realized we didn't know how she should feel, right? So that was really enlightening to me when I was able to kind of put that together and piece those moments together to say, that's a really big gap in the whole experience as a pair, as partners in this whole thing, that, we can, especially on my side, educate ourselves more, be more educated, to be sort of that, person that can advocate for their partner, their spouse throughout all this, and help create a successful and a safe outcome.
Sorry, thank you so much. Can you just tell us a little bit more about some of the efforts that you have going on? I spoke a little about some of the things you've been able to accomplish, but expand on that a little bit for the group, or for those that watching who may not know some of the initiatives that the Tara Hansen Foundation has been credited for and has underway.
Yeah, absolutely. So our first big campaign, or big to me, was our Stop, Look, Listen campaign. So, looking back on our experience, Tara, and talking about empowering women's voices, right? Tara felt empowered to speak up during her experience. I always, give her so much credit for that, because it's not easy a lot of times, myself included. It can be hard to talk to your physician, hard to express how you feel. We put a lot of faith, in the people taking care of us. But, she spoke up and she said, I don't feel well, have pain. This is, I feel almost flu-like. And, she had issues with fainting, and, our whole team knew this, right? But she's met with the roadblock of, you just had a baby. We understand that and we get that. But, you have a woman here who's saying that I don't feel well, and I need someone to, to help me, basically. She's really the only one at this point who knows there's something wrong. So we basically, the Stop, Look, Listen campaign, because I felt like Tara and I really didn't, have the tools to move the needle, to raise the flag, to get the care that she needed in the moment. So the idea behind Stop, Look, Listen is that it's something that we can use as patients to, send that red flag up. And it's something that physicians can use as an indicator. If we, say this is a Stop, Look, Listen moment, or have you heard of Stop, Look, Listen, or anything along those lines, it's enough to get your physician to take a step back, stop what they're doing, look at this patient and their concerns, and then listen to everything, take that next step, that next risk assessment to hopefully get the care that they need. And, in my mind, that empowers not only women's voices, but, the family, the partner, and hopefully physicians too. The idea that we're working together, because this is a team effort, always. And we understand that no matter what we do, we have to work together, and we have to pull everyone into this as well. So Stop, Look, Listen has been really important to me and the foundation, and giving all of us the confidence to speak up for our loved ones.
Amazing. Ryan, thank you so much for all that you do. We appreciate you being here and sharing all of this with all of the other panelists and everyone watching today. I want to now bring in our next speaker this afternoon, Alice Liu. And Alice is an advocacy outreach lead at 2020 Mom, where she has built and activated coalitions of leading healthcare organizations to advance legislation supporting the screening, education, and access to treatment for mothers suffering from perinatal mood disorders. She serves on the policy committee for Mom Congress, which is a mother's rights movement that works with government leaders to advocate for improvements in maternity care, maternal health, mental health care, and policies to support working moms. And Alice, of course, we all know that maternal mental health is such a big part of this. So can you tell us, how does maternal empowerment play a role in maternal mental health? These two go hand in hand.
Okay, well, I think connecting to other peers who have survived from maternal mental health disorders helped me personally tremendously in my recovery journey, in finding providers who could help me, therapists and doctors who were trained to treat perinatal depression and other maternal mental health disorders. And most importantly, it led me to advocating on both a state and national level to develop policies to close the gaps in the healthcare system that failed so many of us. So I actually, if you're interested, I actually kind of prepared some talking points about my story, if you guys are open to me sharing those.
Please, yes, that's what we're all here for. So please share with us and tell us a little bit more about how your experience shaped your advocacy.
Okay, so again, my name is Alice Liu. I'm a survivor of severe prenatal and postpartum anxiety and depression, a debilitating and humiliating illness brought on by the hormonal changes during pregnancy and after giving birth to my first baby. I suffered horribly for 16 months from this brutal illness and was so anxious, depressed, and sleep deprived after having my baby that I couldn't think straight. I wasn't just stressed, I had panic attacks that would leave me disoriented and confused and would give me memory problems, which were scary. I had such difficulty concentrating that I was baffled by stroller manuals and baby product assembly instructions, and had difficulty keeping my baby on a regular feeding and sleeping schedule. I was so ashamed and depressed by how debilitated I was by my postpartum anxiety and depression that I didn't socialize or see my friends for over a year after my first baby was born, because I felt like such a failure of a mother when it should have been the best time of my life. And the worst part was that I had a difficult time finding compassionate, affordable treatment during and after pregnancy. Maternal mental health disorders such as postpartum depression are the #1 complication of pregnancy and affect up to 1 in 5 mothers, but the healthcare system doesn't recognize or support mothers with perinatal mood disorders, so only 15% of suffering moms receive treatment. There's a severe shortage of providers with training in treating maternal mental health disorders, and very few of them accept insurance. So in the process of trying to find help, I kept on getting bounced from doctor to doctor like a hot potato that no one wanted, from my OB to maternal fetal medicine specialists to psychiatrists to a reproductive psychiatry center, back to my OB. It was expensive and futile. I got quoted $500 for specialist consultations and $200 for a therapy session. My antidepressant didn't provide me with sufficient relief, and no one knew what to do with me. And shortly after giving birth, I asked the on-call psychiatrist at the hospital about alternative treatment options for postpartum depression. She told me she didn't know any and provided me a list of 3 specialist reproductive psychiatry centers in New York City. And unfortunately, 2 of the numbers were defunct, and 1 had a waiting list that was 2 months long. She still didn't hesitate to bill me $300 for her consultation. I ended up joining patient communities on Facebook to find other moms who had gone through postpartum depression and anxiety. I found providers and treatments through their recommendations, and so much love, acceptance, understanding, and support. Hearing their experiences living with maternal mental illness and raising their babies into healthy, well-adjusted children gave me hope and changed my life. And more significantly, I connected with an inspiring group of advocates from 2020 Mom and Mom Congress and started working on legislation to change the broken healthcare system that had failed us and our families. In the past 3 years, I have built coalitions of leading medical and maternal child health associations in the nation to advocate for maternal mental health legislation. I have helped organize for the passage of 4 laws in California to support screening to identify mothers with maternal mental health disorders, hospital education of staff and patients on maternal mental health disorders, and referrals to local treatment centers, continuing medical education on maternal mental health for OB providers, and maternal mental health telehealth consult programs that allow OBs to consult with experts in diagnosing and treating maternal mental health disorders to more quickly treat suffering moms. So my lessons regarding maternal empowerment are: find peer support. You're never alone. Moms who have gone through the same maternal mental health issue as you can help you find providers who are experienced in treating those issues, give you helpful tips on managing those issues, or simply offer emotional support. There are some wonderful private Facebook groups to help you connect with other peers. Secondly, get involved in maternal health advocacy, either working with legislators, nonprofit organizations, or public health officials. There's power in vulnerability and in telling your story, and advocacy is such a big part of my own therapy, and it could be part of your recovery too.
That was beautiful, Alice. And, particularly that last line you said, I think that resonates with so many of us here today, that finding power in advocacy and in vulnerability is it's something that I think takes a while to get there, but looking back on our own experiences and seeing the changes that advocacy does moving forward and how it's able to help other moms is really, it is power. And so thank you so much for all that you've done and all that you continue to do with 2020 Mom. I want to bring in, what's that?
Yeah, absolutely. I was just going to say, it's a way of taking back that power that you lost when you felt so helpless and hopeless, and when you felt abandoned by, your medical providers and, maybe some friends in your, and maybe like colleagues who just didn't understand your illness, and just making changes so that other mothers don't suffer the same thing.
I completely agree. And I will echo what you said about the providers. I know Stacy and I have talked about this in regards to pregnancy after loss and parenting after loss and the mental health challenges that come with that. Finding a provider that was able to address those for me was extremely difficult. And it was only through another mom who suffered loss, who I didn't even know, it was like a friend of a friend, led me to the mental health provider that was able to see me through my subsequent pregnancy and my miscarriage and all of that. So that connection is so powerful, and groups like 2020 Mom. What's that? Oh, sorry, I thought Alice chimed in. Groups like 2020 Mom are doing that. So thank you so much for all that you do and for your comments.
You're welcome. Thank you for speaking to me about this.
Of course. All right, let's move on to our next guest now. We have Jay Wilson with us today. Jay is with Melanated Moms. And just a little background on Jay. She is a multifaceted mompreneur. She's a maternal health advocate, And she's a social impact speaker who is working to change the narrative of motherhood through her women empowerment organization called Melanated Moms. Jay has built an advocacy group that has elevated visibility through diversity, inclusion, and equity that has broken the glass ceiling of barriers for its community. Through her platform, she's connected with over 1,000 women worldwide, and continues to live by example by showing her journey through the peaks and valleys of mompreneurship. So I'm going to bring in Jay now. And Jay, first I'd love for you to tell us a little bit about Melanated Moms, and tell us how Melanated Moms has successfully promoted maternal empowerment for women across the melanated spectrum.
Sure. First and foremost, thank you so much for having me and for including me in this conversation. I think it's incredibly important that we get to see the full gamut of how maternal health impacts all of us, right? I think the work of Melanated Moms has been able to become elevated because we have great partners such as the 2 Degrees Foundation. And I'm just really excited to see the work that we're doing just continuing to grow. In terms of how Melanated Moms has expanded, we've been able to really create a very strong network with different women and organizations that really see the value of what maternal health looks like from different angles, right? So we're not just looking at pregnancy, we're looking at moms before, during, and after having babies. We're also looking at the community or the village that raises that mom, right? So, you know, it's very cliche, everyone says it takes a village to raise a child, but it also takes a village to raise a mom, right? And we all come from diverse backgrounds, cultures, language, all these different things that define who we are. But I think Melanated Mom, the difference with Melanated Moms is we wanted to create an inclusive space where everyone feels seen and heard and represented. So that's what we're doing here. Currently, we're working on a lot of projects to talk about these particular issues that have impacted moms across the melanated spectrum. So when I say the melanated spectrum, I'm saying Black women, I'm saying Hispanic women, I'm saying women from different identity factors, right? So it's not just race, it's not just ethnicity. It's however you show up, right? So we want you to still feel included in the conversation. And also know that your inclusion is making an impact on creating the change that we want and we need to see.
Thank you so much, Jay. I really appreciate all of the work that you're doing and that you shared. And I'll ask you the same thing that I kind of asked Ryan. You know, can you tell us go into more detail about some of the things that you have been able to accomplish through Melanated Moms and some of the things that you've seen and heard from your community of women about the real issues that they face in this?
Yeah, so we've been in business for about 3 years now. And in the last 3 years, we've seen a huge change in what we thought we were here for and what we actually are here to do. So initially we started just as a mommy meetup group where we just were hanging out with other moms and asking very superficial questions. You know, what does support look like to you? What does motherhood look like for you? And then we started asking more in-depth questions. What has your motherhood journey looked like? Is it different from what you expected it to be? Do you feel as supported as you thought you would? And then, you know, continuing to take deeper dives and learning more about the maternal health crisis and how it shows up and when we add all of these other factors of culture and language and barriers and barrier breaking. One of our most notable events is our series called Childbirthing in Communities of Color. In 2018, we hosted that event We opened it up to the public, and we partnered with a doula agency to screen a movie called Death by Delivery. And in that screening, we learned, you know, what this looks like from a national level. We found out, when, Black women are 3 to 4 times as likely to die in childbirth. We found out why these women were dying. It wasn't because of lack of awareness or inability to have insurance. It really was around not being listened to, not being valued, not being believed that these were their experiences, right? But then we expanded the conversation by including people who are a part of the solutions. And those women were these amazing doulas who supported moms and who also shared their experiences either through their own birth or through supporting other women through their birthing experiences. And instead of just bringing the problem to the forefront, we added an action plan. And we said, all right, we see what the problem is. We've identified different ways that we can solve it. But what's the next step? How do we create a call to action? So from us doing that, we were able to thankfully become connected with the First Lady's office. And we were able to learn more about the Nurture New Jersey project and to actually be a part of the structure that she's been building out. We were able to work on the Healthy Women, Healthy Families grant and see really how that unfolded through the different phases of conception, from preconception to interconception. We've also been able to be a part of the strategic plan and hold several focus groups where we brought our women to actually ask their opinions and say, like, all right, here are the actions, here are the recommendations. Are these things going to actually work? Because we have a plethora of resources and things all throughout the state of New Jersey. But what we were seeing is a lot of them were working in silos. So like, how can we make a collaborative effort to create the change that's really going to be impactful and that you will actually utilize? And it's been working. So it's been very amazing to see a plan go from just an idea to actually being in implementation, and to continue to be a part of that plan is what we've just been continuing to do. The next step of that has been our training. It's called Find Your Roar. So with the Find Your Roar training, it is an advocacy book that I wrote. We've been able to implement it through Advocates for Children of New Jersey, where we recruited over 100 different parents, guardians, and grandparents to talk about issues that impact their parenting or their grandparenting and how they support their children. But then again, create an action plan. How can we support the issues that affect our children? How can we support the issues that affect us as parents? How can we bring attention to the people who we call the change makers? So our legislators are the people who create policy, the people who can move the needle in our towns and our municipalities and our entire state. How can we have them be the representatives that we need on a macro level to really see noticeable change? So, through those efforts, we've seen more people stepping up to the plate and saying, I didn't know I can be a part of the solution from this level. So what Melanated Moms has been able to do is really ignite a new fire in parents and community members to really see themselves as the advocates that we thought that we needed from someone else, So I love to tell people that advocacy is not a question that you need to ask. It's a demand. It's really a verb, right? So I can't ask you, can I advocate for you? I'm going to tell you, hey, I'm here. I'm standing up for you. Let me show you how I can help you. Let me also show you how you can be a part of the solution. Because there will be so many people that can make suggestions, but if they aren't living the experiences, if they are not impacted by it personally, they may not have as much value or stake in the change being as significant as it needs to be, right? So for us, we're really excited and very grateful to see how the First Lady's Nurture New Jersey project has really impacted the way that Black maternal health has changed, but overall how maternal health has changed for the state of New Jersey. So it's very refreshing to know that we were a part of this implementation, and we just hope that we can continue to do this work every single day. I can do this all day. This is like my favorite stuff to do all the time. So yeah.
Thank you so much, Jay. I love what you said about advocacy and it really being a demand. I think that resonates with all of us who are here today because this is something we care deeply about. So thank you for that. And, the idea that, okay, now an action plan. And that's another part of the reason why we're all here today. And Stacy and Deb will get to that at the end. But I want to just now introduce a quick break. We're just going to take a quick 5-minute break here in a minute. Before I do that, we want to make sure to just mention that at the end of this, we will do a brief Q&A at the end for any speakers that you're hearing from. So if you do have any questions at the end, we'll ask you to drop those in the chat box, and then we'll hopefully have a little time to go through that with some of our speakers. So with that, I'll take a 5-minute break, wrangle my monkeys upstairs who I hear in the background. I apologize for that, and we'll be back with you in 5 minutes. Hi, everybody. I'm going to give everybody a chance to just get back in after our little break here, and we will continue with our program in just a second. Thank you all for a great first half. All of our speakers who we heard from, I'm just really in awe today listening to you all, and I think we all share such a powerful purpose in this cause, and it's really special to see. So I'm really grateful to Debbie and to Stacy for organizing just such a powerful lineup and for bringing us all together in this way. I know it's special for all of us. So thank you so much. Okay, let's move on to our next speaker this afternoon. And we have Dr. Barbara Ostfeld with us this afternoon. I'm just going to give a brief introduction into Dr. Ostfeld's work, and then we'll bring her in to talk about just what she's been able to accomplish, which is pretty incredible, as I know many of you will agree. Dr. Barbara Ostfeld is a professor of pediatrics at Rutgers Robert Wood Johnson Medical School. She's also the program director of the SID Center of New Jersey, which she helped establish back in 1987. And she is a nationally recognized expert on sudden unexpected infant death. Her research contributed to the safe infant sleep policies of the American Academy of Pediatrics, and her work also addresses racial disparities in maternal health and birth outcomes, as she serves as a member of the NJ Perinatal Quality Collaborative Health Disparities Work Group. Dr. Ostfeld was recently honored as a champion for children by the New Jersey chapter of the American Academy of Pediatrics. As a grandmother of 7, she remains a committed advocate for empowering women to work together to achieve healthy outcomes for themselves and for their family. So Dr. Ostfeld, thank you so much for being with us this afternoon. I'm frankly in awe of everything that I just read and all of the work that you've been able to accomplish. In regards to the work of the SID Center of New Jersey in particular, though, the work that you have done has contributed to our state now having among the lowest rates of sudden unexpected infant deaths in the US. So how has the SID Center empowered mothers to achieve this outcome?
Well, thank you, Marissa. And I just want to point out that so many of us on the call today, and myself included, share a bond that we never expected to have, and that is the loss of a child. But it's also clear that there's an additional bond here too, and that's the commitment to making it better. So Debbie and Stacy, I want to thank you and the 2 Degrees Foundation for focusing on women's empowerment and for inviting me to participate in this roundtable today with colleagues and friends whose work I value and count on. So thank you so much. We established the SID Center almost 34 years ago. And so very few people may still remember that it began because of empowered women. These were mothers who had lost their infant to a sudden and unexpected death, and they wanted 2 things. They wanted to be able to find each other in order to grieve together, and they wanted to use their collective voices to encourage more research into sudden infant death syndrome. And the stories that these mothers told had a profound impact. It led to legislation and to a New Jersey Department of Health grant and the birth of the SID Center of New Jersey. By definition, as I'm sure you all know, SIDS is a death for which no cause has been found. That means for the rest of their lives, these parents will never have an answer to the most basic of questions. Why? So from the start, one of our missions has been to offer bereavement support, and that includes families helping each other along the way with this unique aspect of grief and with a subsequent pregnancy, which so many families go on to have. Our mission also includes conducting research and providing risk reduction and preventive education. But in the beginning, there was virtually nothing known about how to prevent or even reduce the risk of death, because these were deaths whose causes were defined as unknown. And over the past 3 decades, our research and that of other groups have led to identifying medical issues that turned out to be the cause of some of these deaths. and to learning that even though most of these deaths remain of unknown cause, we can and have identified the conditions that elevate risk. And most importantly, we've learned how to reduce those risks. And this information makes up the Safe Infant Sleep Guidelines of the American Academy of Pediatrics. And as Marissa mentioned, our own research at the SID Center has contributed to them. As part of our work, we provide that education to physicians, nurses, doulas, lactation consultants, social workers, social service providers, childcare programs, home visitors, parents, clergy, first responders, and I could go on and on. And as part of that process, we also raise awareness of the disparities in the adverse social and health determinants that bring about the birth of a baby who is already at higher risk for a sudden unexpected infant death, even before he or she is placed in any sleep environment. And we value our partnership with Nurture New Jersey in shining a light on and addressing these disparities. Knowledge is a very powerful thing. It means that apart from hoping that things go well, there's actually a lot that a parent can do to help. But there's a big difference between knowing what to do and doing it. And in fact, it's been said that the hardest thing to change is human behavior. How and where you put your baby to sleep is an intimate act. It's informed by culture and tradition and personal choices. So to change actions and not just knowledge, a successful discussion can never just be about telling a parent what to do. Instead, we have to find common ground. Namely, we all want a good outcome. And we give each other what Debbie describes as a safe space for honest communication, for conversations that are free of judgment. And in this respectful conversation, a parent can and should ask questions and express concerns and get satisfactory answers. And isn't that part of a parent's advocacy on behalf of their infant? We've learned that the most powerful megaphone in a community is a knowledgeable mother's voice. She then brings that information back to her network, and as a trusted member of the community, she amplifies the advice that's being given by physicians and nurses. And being of a community, she can identify barriers like the absence of transportation to a health clinic. So her voice is not just an echo, it's also a unique and necessary call to action. But reducing a baby's risk for a sudden unexpected infant death doesn't just start at how we ensure a baby's sleep position or other safe sleep measures. It turns out that some babies at birth, as I mentioned, are already at higher risk than others. So for example, when an infant is born prematurely, that baby starts off life already up to 4 times at greater risk for a sudden unexpected infant death. Our Black infants are at greatest risk for a preterm birth. Smoke exposure adds additional risk. And we've also learned that for a good outcome, a mother's health and well-being at every stage of life matters. Not every health challenge can get fixed on that first prenatal visit. And neighborhoods matter too. If there's a lot of crime, a working mother may be afraid to keep her doctor's appointment at night. And if there's a high level of lead in the water, the risk of having a preterm baby goes up. You can see how important it is for programs to reach out and work together, and for disparities in exposure to any of these conditions to be recognized and resolved. But these facts become even more powerful, and collaboration increases when brave women tell their stories, as many already have, and as many of you already have. I think it's important to point out that empowering a woman with this, women in general with this information doesn't mean blaming women for tragic outcomes. A community empowers women by how it supports a woman's needs. And that includes access to healthcare and good nutrition and safe and healthy environments. And in turn, when a woman becomes aware of barriers to good outcomes and raises her voice, the community, including healthcare providers and policymakers, must respond just as they did with the SID Center of New Jersey. And a good outcome also needs an environment without the emotional stress of racism. Implicit bias has measurable consequences for maternal and infant survival and health. It matters in our work too, and attention is finally being paid to what it does and what needs to be done about it. And here too, women's collective voices are making a difference. Each story motivates change, and each woman facing these issues has an important story to tell. And finally, empowering women also means empowering her network. We all learn from our own mothers, but sometimes their well-intentioned advice may be out of date. Here's an example. Those of us who are now grandparents, and that would include me, raised our infants sleeping on their tummies because that was the advice we were given. But now we know that back to sleep is the safer practice. A mother's support for her daughter's parenting has enormous impact, and we therefore must be sure that information about health and safety reaches across the lifespan and involves grandparents as well. Otherwise, a newly enlightened mother may bring her baby home and, let's say, place that baby on his back, only to hear her mother react with horror. What are you doing? Put that baby on his tummy. I raised all of you like that, and you are fine. But the truth is, not fine. Lucky. The rate of SIDS has declined by more than half since Back to Sleep. And that discovery alone has been named one of the 7 leading research findings in pediatrics in the last 40 years. So empowering women has no age limit, and the rewards are great. Possibly the one megaphone louder than a mother's is a grandmother's. The SID Center does not operate in a silo. None of us does, and it's clear from this conversation we're all having today. We need each other. We collaborate. We work closely with the public and with the state's medical and public health and social service and education and community organizations. Our shared goal is to improve outcome for women and children. We are proud partners of the First Lady's Nurture New Jersey initiative. In every project, the strongest ally for change has been an empowered woman. This is how our work began and how New Jersey has become a state with one of the lowest rates of sudden unexpected infant death. For that to continue, so too must opportunities continue for women to express their concerns, be heard, and have impact. And by the way, if in this conversation anybody did want to learn more about safe infant sleep, please check out our public access Facebook page that's labeled SID Center of New Jersey, and our free mobile phone app called SIDS, S-I-D-S Info, which has both English and Spanish text and voiceover. Thank you so much for letting me be part of the conversation today.
You know, Dr. Ostfeld, when we were preparing for this, Stacy and Deb said, well, Dr. Ostfeld, I could listen to her speak all afternoon because every word she says is so powerful and just speaks to the mission of this entire event. And after hearing all that you just shared, I couldn't agree more. So many just nuggets that I will hold on to from your comments. But what I love, that analogy you used of an empowered mother being a megaphone and something that should be loud and clear, and the power and reach that has. So thank you so much for all of your work and for your thoughtful comments, and for just that unity message that I think we all really agree with. Thank you so much. I'm going to move on to our next guest now. Dr. Ostfeld just mentioned some of the racial disparities. We talked about that a bit with Jay from Melanated Moms. Now we have Nadia Hussein joining us from Moms Rising. And I'm just going to give a brief introduction to Nadia and some of the work she does. I had the pleasure of actually interviewing her for NJ Mom on our NJ Mom TV Live a few weeks ago as well, speaking about maternal health. And I just learned so much about Moms Rising. But for those who are unfamiliar with the organization, Nadia is a senior justice campaign director with Moms Rising, which is a nation advocacy organization for moms and for families. And this past fall, she was actually elected to serve on her local Board of Education, where she will begin her term as commissioner starting, well, she just started this past month, January. So congratulations. She's actually the co-founder and current board member of the Bangladeshi American Women's Development Initiative, which is a community initiative organizing with Bangladeshi women and girls in New Jersey. And she serves on the National Board of Directors of the American Civil Liberties Union as the affiliate representative from the New Jersey ACLU affiliate. And as if that were not all enough, she also serves on the ACLU New Jersey board and acts as the board equity officer. She's worked on voting rights as a youth organizer and as an advocate for community, as well as a domestic violence advocate for South Asian women and families. So advocacy, Nadia, we see is in your blood and in your bones, and we thank you for all the work you've done. I want to ask you in regards to Moms Rising, we know that when voices join together, it can have a powerful impact on the many issues that women face. So we've seen a little bit of this here today, but tell us from your perspective, why is collaboration so important for empowering mothers?
Thank you so much, Marissa. I just wanted to check, you can hear me, right?
Yep, we can hear you.
I'm not turning into a cat or anything, but my Zoom sometimes gets a little funny. Yes, listen, with collaboration, none of our work, we've had some incredible activists and experts speak already. None of our work happens in vacuums because we don't live in vacuums, right? When we talk about things like intersectional feminism or just our intersectional lives, our lives do not occur in a vacuum. The lives of the communities we are part of or the communities that we are advocating for and with do not happen in a vacuum. So we're so much stronger when we work together, when we not just collaborate, but we're in communication, we're in respect with one another. You read my bio, and I get exhausted reading my own bio or even talking about my bio, but a lot of the reason I do a lot of that work is as we look at some of the maternal health issues in not just our state and nationally, and when we talk about something like maternal justice, why is it called justice? Because it means justice on all fronts, and the collaboration piece is just so critical, because when we are going to be talking to a policy, right, when one voice is great, but multiple voices together, unified voices, or voices that are even bringing up different points of view, different perspectives, maybe a point that was missed, a point that's important to uplift. It's just so important for that piece for us to really come together. I will say for Moms Rising, our work is not just driven by Moms Rising at all. Our work is so collaborative, especially the maternal health work. We follow the lead of incredible organizations like Black Mamas Matter Alliance, right, that were leading and have been leading this movement to save Black moms and uplift Black moms. And so it's also important when we collaborate to sometimes know that when it comes to impacted communities, when it comes to communities of color, that to be in a role where you can really uplift and support in the way that is really impactful, right? By sometimes stepping back and stepping back and being part of a support system, a sisterhood, to really join in with others to uplift is really key and important.
Sorry, I forgot I was muted. Thank you so much. I completely agree. And, we have been talking about racial disparities, and I saw your question you just dropped into the chat, which, just a reminder, if anyone does have questions for any specific panelists, please drop those in the chat box and we'll try to get to a few of those at the end. We'll have time to get to a few. But Nadia, you brought up that the death of Black infants is still 2 times the rate of white infants. And we heard a number of different statistics from the start of this related to the racial disparity. What have you seen in the organization in terms of that, both locally and nationally, that has been able to be accomplished, and what still needs to be done? I know there's so much more that needs to be done.
Right. Well, that stat of, even though it's great that SIDS rates have reduced, of course, that's amazing, but the disparities have not been bridged, right? Black babies are still dying at twice the rate of white babies. And that goes in line with maternal health. Black women in New Jersey are 7 times more likely to die from maternal health related causes compared to white women. That's actually worse than the national average. And the national average was already bad, with Black women dying at 3 to 4 times the rate of white women. And this is including taking into account things like economic status, where you live, education level. Like in the end, that's not what's causing the deaths. And the deaths are being caused, these disparities are really caused by systemic racism, racism in systems, racism in society. It all comes out in social determinants of health. And in terms of addressing this, what I think is always so important in this work is we actually know what the solutions are. It's not a question of, wait, how do we change this? Or what can we do? We don't know what to do. We actually do know what to do. The answers are there. It really is about things like healthcare access. 60, I have to always say that because people think it's 16, 60% of maternal deaths could be preventable by improved access to quality healthcare. That just tells you that over half of these deaths nationally don't need to happen. They don't need to happen. That's a solution that can be fixed by fixing a broken healthcare system, by addressing the disparities, the racial disparities in this healthcare system. And there is some work happening. For example, I know this is in the news and I'm so excited to see it, the Black Maternal Health Caucus's Black Maternal Health Omnibus Bill, a package of 12 bills that organizers like leaders like Chanel Portia from Ancient Song, Black Mamas Matter Alliance really took the lead and incorporated the work to show that these are the ways you can do solutions. So even at a federal policy level, we're seeing not just the stories being uplifted, but policies addressing things like social disparities, getting more Black folks and communities of color to become healthcare workers, right, and enter these fields, improving telehealth. The Omnibus also covers vaccinations. So what's wonderful is seeing the policy shifts and the policy pushes. This hasn't passed yet, right? It's been reintroduced, so it needs to pass, right? There needs to be that political will and organizing and lifting a voice in grassroots to pass it. And so that part's important, but that part can't happen without the voices on the ground, the experiences, the stories of birthing people being uplifted and being amplified. And I'll also say even there's been models, Jenny Joseph, midwife Jenny Joseph. If anybody here does not know who Jenny Joseph is, I say Google her, look at her work. Her the birthing method she really put forth has completely bridged the racial disparities piece, completely bridged it. So can her model, and her model is being implemented in some policy spaces. But I guess all I'm saying is there are already answers, okay, and solutions there that have been proven to work, but it's about enacting that, lifting up the impacted communities, the leaders from those communities to really be not just at the decision-making table, but calling the shots, being listened to, and their solutions being invested into. And hopefully we will see that, but we do have a long way to go.
Thank you so much. I think that gives us really a good landscape of where we are right now from a policy perspective. So much appreciated, Nadia. Thank you so much. Let's move on now to our next speaker, Jill Wadnick with Montclair University, as well as speaking of birth. And I'm just going to give a brief background on Jill before we welcome her in. Jill is a Lamaze childbirth educator and policy expert working at Montclair State University on improving maternity care. And she's the mother of 3 teenagers, God bless. She has advocated for respectful, equitable maternity care for close to 20 years now. On the state level, she's worked with the Office of the First Lady's Nurture NJ Project, the New Jersey Perinatal Quality Collaborative, and the New Jersey Hospital Association, testifying at hearings on maternal health equity. In addition, she's worked as the chair for advocacy and collaboration for Lamaze International, and she works closely with Title V home visitation programs, and her experience as a doula and as the director of a successful community doula program has made her an expert on centering the voices of women and families in developing policy proposals. Jill also supports a small nonprofit entity, Speaking of Birth. And with that, I'm going to welcome Jill in and talk a little bit about the maternal health work that she has done. And Jill, I want to ask you, what do you consider to be the most effective way to encourage maternal empowerment with pregnant people?
Thank you for that question. And I just want to take a moment to really hear and absorb every other person that not only has been seen in this gathering today, but is very visible. The people that are here in the chat room, some of them are my mentors and teachers, colleagues, and the fact that this conversation has been convened by the 2 Degrees Foundation, to me, is the art and heart of nourishing strong relationships. Your question reminds me of the essential ability to listen to each other. I actually just put in the chat box a challenge that I would really ask all of us to listen to those. Maybe we don't know the full story, but the vulnerability today by the other presenters and programs, and that I hope we will continue to listen and amplify with each other, is part of what is transforming empowerment in maternal infant health and families in New Jersey. So I don't know if I can do this, but I have seen so many amazing organizations and people that are attendees. And so I hope we might be able to use the chat either now or whether at the end, because part of what, you know, the root word of empowerment is it's actually a French word, and it means into and it means roots. And part of what I think we have seen in New Jersey is not necessarily knowing what other programs or services are doing, either regionally or geographically. Or take, for example, the important work that 2 Degrees Foundation does, finding that when a family is in trauma, when a family is in grief or in loss. And so I would challenge all of us today to foster right relationship, because we have gathered together. And I don't know about you, but every time I do hear the loss of what Mr. Hansen speaks about with his wife, Tara, and when hearing the words of Debbie, I'm grieving. And so we can hear each other and hold that framework to listen well and not make today an isolated incident. There's so much opportunity in the policy and the legislation, and I'm delighted that these words follow Nadia, because Nadia amplified the Momnibus that started, reintroduced 2 days ago, and that other community-based national leaders like Ancient Song were part of the technical assistance and guidance of those proposed pieces of legislation. I would encourage, if you don't know the different iterations of the Momnibus supported by Senator Booker, again, New Jersey is in the House, that you look at the 12 pieces of legislation, and perhaps as a state, we can mobilize with each other. The bills are comprehensive, everything from covering, making sure the role of veterans get high quality maternity care, to pipeline of workforce development centered in anti-racist understanding and knowledge. So we gather, we grieve, and I think we mobilize by being able to move out of silos and move into ongoing coordination and collaboration together. I hope, and I would challenge all of us, that this is not a one and done gathering. The people who are in the chat room, I hope that we elevate the voices and we get to see your faces. The lived wisdom that's happening in municipalities is so essential. You know, and I think that's part of what to me is so interesting. We are a state that has, what, 612 school districts?
and something called local control. So if you go to other states don't deliver education maybe on a zip code level the same way New Jersey does. And while we may fight about the narrative of Central Jersey, the reality is that our zip code specific municipality, I believe, has really been a barrier to successfully transforming maternity care, because it makes things even more fragmented. And so I hope if we gather again, that we really can make sure that municipal health officers and people who are on a zip code level, in addition to community-based organizations, leaders in the early childhood center spaces, the unlikely allies of maternal infant health that are walking with families in this continuity of care, are welcomed by us, not only to mobilize and pass Momnibus through our federal legislators, but to make these relationships that are authentic and equitable and rooted and resilient together. I am really, really humbled, not only by watching how the landscape of maternal health is changing, but that we now are really understanding these gaps from clinical to community-based care are not sustainable. So I challenge all of us to sit with sustainability, both on a personal level as well as an organizational level, and think about how we can ameliorate gaps and create a greater ecosystem that's fertile and centered in joy and justice of families in New Jersey.
Thank you so much, Jill. That was beautiful, and I couldn't agree more in terms of the collaborative effort and the power that that has. And I think all of us have spoken to that in some way today. And I just got a comment right now from someone in the chat. Thank you for speaking to the importance of collaborative care models and breaking the silos that are often in the way of taking greater action together. This is so true. And before I bring Jill, Debbie and Stacy back in, Jill, just to jump off of what you had said about that, I think Stacy and Debbie and I know, but I'm sure many of the other people who spoke today, Ryan and others, found that in our moment of need, Alice spoke to this as well, in that moment of need as a mom, finding what we needed was the hardest part. Once we were able to find that support, you realize there are people out there who want to help, who have either experienced something similar to you before, or who have dedicated their lives or their time, as many of us here today have, to wanting to be an advocate. But it's seeking that out when you can't really even think for yourself, when you're in a moment of crisis and trauma, that I think is on now us as a collective group to try to make easier. And I know that's a mission that me and Stacy take very seriously. It's one I do as well. I mentioned at the start of this, I was working at News 12 when my loss happened, and I actually did an entire series on pregnancy and infant loss at the station. At the time, I featured Debbie and Stacy in the 2 Degrees Foundation. I featured the Tears Foundation, which is another organization I've been involved with a lot. And now at NJ Mom, I host videos for njmom.com. I just had Nadia and Debbie on to speak about maternal health, but finding these ways to integrate this conversation, as difficult as some of these topics are, into the mainstream conversation, and not making it a scary topic, and not making it something to scare moms or to have them say, oh, I don't want to hear about that. That's going to make me anxious or nervous. These are realities that so many people in New Jersey and in our country face every day. It is our lives, and it is so much more common than people realize. And so the idea of coming together as a collective one and making that our mission, I think, is so powerful, Jill. So thank you for bringing that up to kind of close our comments today. I think it was the perfect note to close on. I do want to just mention our Q&A. If you do have any questions for any of the speakers, please drop that in the chat. I know we have a few there. Before I get to those, we do have a few questions from our survey for our speakers. So I want to get to that now. These were questions that came in through the survey that Debbie and Stacy sent out for this event. So the first question is for Ryan Hansen. And the question is, Ryan, how do we engage men so that this is not perpetuated as purely a women's issue? I'll turn it over to Ryan for that.
Yeah, absolutely. So for me, I think one of the goals that I've always hoped in speaking and telling this story is that, I can show other men in this situation that it's okay to talk about it. It's okay to, talk about the experience, talk about, what it's like to, be a partner and go through this whole thing. And, I think that sometimes, classically, men aren't great at communicating at times, and especially when it comes to things like this, but, it's an experience that we go through together, and, we should be a part of it, as one. So I think one of the ways, and the way that I look at it with the work that we do at the foundation, is it's teamwork, right? Like my brother and I were raised, to really believe in the family unit as a team. So, when we start building our own families and our partners are our teammate in this, and, in the good times we pick them up, in the, in the bad times we pick them up, in the good times we celebrate with them, but we do all these things together, right? So I think becoming an advocate for their care, really should naturally fit in the way that our relationships are, with our partners, and the fact that we can hopefully take some of that burden off of the moms during this experience, because they shouldn't have to bear it all. They should know they have someone in their corner to fight for them and advocate for them, and that's okay. And I hope the messaging that we deliver, helps people feel confident about that. And really, we can stress the idea of teamwork, not only as two, but as a family, and, really along the pregnancy journey, kind of build that team aspect with the healthcare providers as well. So I think that's our goal in all of this.
Thank you, Ryan. That makes a lot of sense, and I love the team unit idea. I feel the same, and I think that's really impactful when you speak to it from that perspective. Families are teams, and just the work you've done has been so inspiring. I have a question from the survey now for Jill Wadnick. Jill, in your opinion, how do we begin to create a greater sense of urgency around pregnancy and infant loss in the maternal health?
So I'm privileged to answer that with the ability of teaching prenatal childbirth education every week. And I think that childbirth educators, so I'll speak for one part of my profession, we have an essential responsibility to make sure whatever birth may ask of someone, that we have normalized that there are resources for it. I don't want to normalize loss and trauma or racism, but I want to make sure that I'm giving out resources on equitable, high-value care that's written and centered and highlighting organizations and people and programs on the full spectrum of what birth may ask of us. So I think childbirth education is an untapped opportunity. And so, for example, I know for specifically the signs of preeclampsia and the signs of postpartum eclampsia. The Preeclampsia Foundation has tear-off sheets, infographics. So it's really easy for childbirth educators. I can't prescribe, diagnose, or assess. I can do health education. So I can take that information and make sure that it's been seeded. And so some of the same resources to make sure that if someone is struggling or having questions, it's under the landscape. We are having this conversation in the time of COVID, And I would highlight that the March of Dimes has a COVID-19 specific birth communication toolkit in English and in Spanish with questions and resources that help expectant families ask questions that literally might change week by week. Will I be tested for COVID-19? How is what does telehealth mean in the prenatal period? So using health educators in non-clinical settings, I think is really, really important for making sure that it's not just in trauma and in grief that we have heard of the 2 Degrees Foundation, but that expectant families know if these services are needed, here are the regional and community people and places for peer support and information.
Thank you. So important, Jill. Really appreciate that. This next question is for Jay. And we spoke a bit about this with Nadia, but Jay, we would love your input on it as well. There have been a lot of efforts and attention given to the troubling maternal death rates here in New Jersey, as we heard about a lot today, especially regarding racial disparities. So with this attention and subsequent efforts, have we begun to see any results or positive impacts?
Absolutely. We've seen a lot of change and we've seen a lot of effort from many angles, right? So just looking at what this particular conversation has sparked, right? We had 100 people register to be a part of this conversation. That in itself is a positive impact. So we're seeing how others are valuing the vision of positive birthing outcomes for mothers all across our state, just from people showing up today, right? Additionally, we're learning how to create these villages with one another. I think, Jill, you talked about it earlier about how we're not working in silos anymore. We're creating collaboratives and we're talking to each other about how to solve this problem from wherever we serve our families, right? Again, we also, definitely have to highlight the work of Nurture New Jersey and seeing how that really has taken a new direction on recognizing what birth looks like from all of the angles that we experience it in, right? We've also been seeing, sorry, I wrote notes. We've also seen how race has been identified as an actual disparity. It's no longer that almost microaggressive thing where it's like, oh, maybe it was this or maybe it was that. Like people are actually recognizing race is and has been historically an issue that has impacted the birthing experiences for moms. And we're creating the change around it. I know one of the work groups that we're a part of, they've been talking about implicit bias and the Harvard study that really, the IAT, that has really revolutionized creating awareness around our own biases and how to create new solutions so that we can check ourselves, because we all have these biases, right? But we also need to recognize that whatever bias I have should not impact the experience of birth for this woman. And then we've seen new changes happen on different levels. So from the federal level, we have the Black Maternal Health Caucus, we have Moms Rising, we have March for Moms, we have all of these huge organizations who have revolutionized what support looks like on a policy level. And then on the state level, we have us really here on the ground that's seeing moms from every angle who want the same type of support. The 2 Degrees Foundation and Melanated Moms, we've created a virtual space on Facebook, virtually there, where we're able to host these as like regular conversations. And it is inclusive. So knowing that race has particularly felt like a barrier now we're seeing that it's not. We're breaking down those walls. We're breaking those glass ceilings. And then last but definitely not least, we're highlighting how different government agencies that have existed for a long time are now coming to the forefront and listening to the community members and their needs first. And they're seeing that create new change. That has been a positive change. So my favorite to always highlight is our family success centers. I think New Jersey makes such a really great effort with these spaces being in all 21 counties that really exist for the people in that community to feel successful, to feel heard and seen. And you know, the First Lady's office has been funding this, or not just her office, but the state itself has been funding how to create family awareness in these spaces. So I see us being able to keep these conversations going and eliminate race as a barrier through spaces like that.
Thank you so much, Jay. And thank you to everyone for all of your work, all of your thoughtful responses, your comments today, and adding to this meaningful conversation in your own ways. It was a pleasure to be a part of this. I want to again thank Debbie and Stacy for having me. They have a few more things to go over before we wrap things up, so I'm going to turn it over to them.
Stacy, you're muted.
Sorry about that. I'm not good with the Zoom. Marissa, we can't thank you enough for being here and for beautifully moderating today's discussion. I wish we met under different circumstances, but nonetheless, Debbie and I could not be more grateful to have your friendship and support over the past few years. So thank you again. So just to talk a little bit about our survey, we are still in the process of collecting results, but hope to have a readout to share with everybody sometime soon. So if you haven't already filled it out, please do so. And I'm going to share my screen because we do have some information from the survey that is important. Okay. So with that said, through the survey, we were able to identify some truly meaningful successes, such as all the important work and extensive outreach being done through Nurture New Jersey, seeing an increase in women seeking mental health support during the perinatal period, the funding of doula programs, and the various platforms designed to help families heal after traumatic maternal health events. We also found three main challenges that organizations were facing when promoting maternal empowerment, and they include inadequate funding, the need for more enhanced educational programs for mothers, birthing people, and the community and healthcare professionals, and then the lack of public awareness opportunities. Granted, while these are already pre-existing challenges, I think it's imperative that we continue to strive to resolve them. When we asked how we could begin to build on the successes, overcome the obstacles, and meet the needs of some ideas were to promote and incentivize working collaboratively versus in silos to better coordinate programming and dissemination of resources. We also heard continuing seeking solutions with public and private partnerships, to devise a full spectrum maternal health care training and education program for community health workers, medical professionals, and service providers, and that we need to transition from a trauma-informed system to a more healing-centered approach. When asked how we can begin to collaborate and better promote maternal empowerment here in the state, some of the recommendations were to publicize success and challenges and share with the community at large so that lessons learned can be used for all, useful for all. Offering support to grassroots organizations and building a movement of moms who advocate for more equitable, accessible, and high quality care. Creating a collaborative full spectrum mental health awareness campaign. And lastly, providing more opportunities to connect directly with birthing people who want to share their experiences.
Thanks, Stace. Okay, so next steps. Let's talk next steps. So as for next steps, our survey results point us in the direction to establish a communal space where organizations and advocates can work together. From there, we can collectively begin to identify, create, and distribute content that will help encourage maternal empowerment throughout the state. What we've learned here today is that the unique and complex needs around maternal health would greatly benefit from improved statewide coordination and commitment. It is unproductive to work exclusively in silos. Our contributions end up fragmented, and in the end, we're not able to make the kind of impact that we all want and are fully capable of making. So to be effective, we will need to meet regularly, source new funding, be sensitive and supportive of each other's work, create a strong referral system, and improve knowledge sharing by increasing visibility into who is doing what. At the end, coordinating efforts will be more streamlined. At the end of the day, this kind of mapping and relationship building is needed now more than ever. In the end, we have a responsibility to empower all women and birthing people to achieve healthy outcomes for themselves, their unborn babies, and their families. That starts with encouraging them to ask for help when it's needed, urging them to ask questions and to raise concerns, inspiring them to share their stories, and most importantly, empowering them to act. Because action is the very first step in creating awareness. And action is what I hope we will see from today's meeting. Before we go, I just want to thank Marissa and Ryan, Barbara, Nadia, Jill, Jay, and Alice. Thank you for agreeing to be a part of this especially important conversation. I have chills. I can't believe we actually got everyone to sit together to do this. Today's discussion would not have been complete without any of you being on the panel. Your stories and your passion to right what is wrong is inspiring, and we are truly honored to stand alongside you and look forward to having the opportunity to collaborate with you in years to come. And to all our attendees, thank you for choosing to spend your afternoon with us. May this be the first of many conversations that we have geared toward weaving empowerment into an all-inclusive maternal health conversation. We hope to see you all again soon. Be safe and stay well.